So today I'm introducing you all to Dr. Avi Charlton. Thank you so much for being here today.
Thank you, Tracy. Nice to see you.
Nice to see you too. So are you able to share with everyone just a little bit about who you are?
Yeah, so I come from Hong Kong originally, but I've been in Australia since I was 18. I did medical school in Melbourne University, and through all the training, I became a GP. So I've been a family doctor in Wantirna in the suburb of Melbourne and I worked in the same clinic for about 14 years. So
Wow.
it's very rewarding working in the same clinic. I've met lots of patients and I have lots of regular patients, and some of them have become from babies, become kids and teenagers, and I see all sorts of medical conditions, from kids having colds and flus and mothers being pregnant and lots of women's health and pap smears and mental health, diabetes, and lots of metabolic syndrome. So I'm just your regular family doctor that you see in the GP clinic, and we are Bob Billing Clinic. We work middle class in Wantirna. So yeah.
Must be so rewarding. I mean, I just don't it's not the case really that often now that, you have the same GP for, the whole period, and it just doesn't happen as much anymore. People sort of tend to move around, and there's much more, the clinics, a lot of them are just get them in, get them out. And, it's lovely to hear that you still have that sort of family, connection, and have been in the same place for such a long time.
Yes, yes. So I find it very rewarding, and I see
Mm,
a whole family coming in. There's a lot of
mm.
patients that keep coming in to see me in the long term. There are people that come and go, and then sometimes they move on after 10 years, and then you miss them. And but overall, it's quite a rewarding job.
Yeah, awesome. So how did you become so passionate about low carb?
So I have a personal journey in that I um, did a challenge with my gym. So my gym has an 8-week challenge, and the competition was the most percentage of fat loss in that gym. So I thought I'll give it a go. And what the personal trainer does is he posts all the macros that we have to eat, and he suggests how many times exercise a week. So we had to put the protein on the scale on top of the plate, 120 gram of protein and 30 gram of fat and 60 gram of carbohydrates, something like that. And we have to follow his advice. And the competition after 8 weeks was to see how much fat we've lost. So I thought I'd give it a go. And after doing this challenge, I've realized that it's all the carbohydrates that has to go. So I've learned this new way of eating, and looked into the low carb diet, and find that it's a game changer. I feel much better. I've lost a little bit of weight that I wanted to lose, and I'm happy with how I am now. And I feel lots more energy, less hungry, and less addicted to food, and it's changed my life. So I did a few courses and looked into low carb, low carb down under, and obesity course, and recently Nutrition Network. So that's given me a whole new world of educating my patients on low carb diet. So I've set up my own low carb clinic in my general practice. Um, I wanted to help my patients to learn about low carb. There's lots of obstacles because people are very, they don't want to know about it, and very hard to change their behavior. But there's lots of there's lots of patients that have benefited it, and I have a lady I've just weighed her last week, and she's lost 20 kilos in the last 6 months.
It's great.
So lots of amazing stories. So I hope to
Mm.
change more lives. Yeah, it's been an amazing journey. I've learned a lot and still learning, lots and lots of things to learn.
Yeah, it's interesting how you were saying that, you had to, I guess it was on you to go and learn this stuff, because it's not really what you learn when you go to medical school, is it?
No, not at all. We've been taught the old-fashioned way that we have to avoid saturated fat. We have to eat grains, the old-fashioned food pyramid, and the cholesterol theory that we have to lower the cholesterol and reduce the risk of heart attacks. That's cholesterol is the culprit. I actually talked to my GP friends about all my new learning, and they don't believe it because that's not how we're taught in medical school. So it's a whole new world.
It is a whole new world. And I've been in the world for sort of 6 years now, and it's grown a lot in 6 years. And to me, it's kind of a groundswell. I think with the advent of the internet and the growth of that, people themselves are finding out a lot more about it. But there's still, I say, when we move out of this low carb bubble, there is still so many people and doctors, not whether they've not even heard about it or they're just not interested in, finding out more about lifestyle change. But I think eventually that will have to change, because I think people are going to start going to their doctors. And if they're not going to, sort of give them information on how they can get off their medications, they'll probably go elsewhere. So it's interesting, isn't it? It's
It is,
just such
yes.
yeah.
I hope people, yes.
Sorry.
I hope people do change, because there are so many resistance to change.
Yeah.
But eventually, I think people will have to know.
Yeah, and though it's interesting too what you were saying, how sometimes people, they are resistant to change, because change is hard when we don't understand how it works. And our brain doesn't like change; it loves everything to stay the same. And I know people that have been to a low carb GP and have actually decided not to go back to them because they don't want to. As you say, they just don't want to change. So there's an element of, a huge element of that. I think we have to kind of educate people that it's not as scary as we think, that when you understand how change works, there is definitely ways around that. But yeah, just a huge gap between, people that understand this and people that, I guess still live in the dietary guidelines and what we're told. And, yes, fat is bad, cholesterol's bad, and all that sort of stuff. But yeah.
Yes, absolutely. Yes.
So how have you incorporated your journey and your knowledge into your summit chat?
So my summer chat talks about my journey and how I became a low carb GP, and also my hobby, which is I became a runner from no exercise at all. So I decided to do exercise and for weight loss, and I took up running. How running became my obsession and compassion, something that I love doing now. And now I run 4 times a week, and how I trained and ran a marathon, and it's changed my life. I had a goal, and it's absolutely mind-blowing experience that I've had. So my summit will talk about how I took up this hobby, how I became a low carb GP, and how you can incorporate running and exercise together. You don't rely on carbs to do exercise, and how you can use the fat and the protein to fuel the exercise and actually feel good about it and reduce your risk of metabolic disease, obesity, diabetes, and all those things.
It is amazing how many people take up running or, exercise only after they've made the switch, because, I guess we find we have so much more energy than we used to have, and it just feels amazing, doesn't it?
Absolutely, yes. It's my mind, my meditation. I love going run.
Yeah, awesome. So one of the questions I get asked a lot, that I'm asking all my guests chatting with me on this Facebook group, is low carb sustainable? What's your view around that?
I think it is, absolutely. So I don't think we need the carbs. We can have the carbs. We can have it every now and then, every once in a while, when we go out, when we socialize, we can have some carbs. But ideally, in our main diet, we try and reduce our carbs, reduce processed food, and mainly eat real food, eat meat and vegetables, and not too much processed food, and including the grains and the bread. We don't need to have it, and I actually feel much better without it. Lots more energy, less craving, and I feel less tired. I sleep better, better body composition, and exercise better.
So you've got two boys as well, so a husband and two boys. So how have you incorporated this into your family? Have you shared it with them, or do they kind of eat, differently to you, or has it changed at all?
Yeah, so my boys are 8 and 11, and I have a husband. They're not strictly low carb. They like to eat a little bit of carbs, but I try to cut down their processed food, cut down their sugary drinks, and cut down their sugar. The boys are allowed to have sugar once a week, or mainly with treats, and hopefully, ideally, not during the week. They still have their breads, they still have some root vegetables, but not too much.
Yeah. I think, just getting rid of the processed foods, as much as you can is such a big thing, with the soft drinks. If we can do that, within the family, we're going to be doing a long way to helping our kids stay on track with their health. So
that's it. Yes.
Yeah. Well, fantastic to meet you, and thank you so much for coming and chatting with me today, and really looking forward to your presentation in the summit. And yeah, thanks so much, Avi.
Thank you, Tracy. Thank you. Thanks for having me.